Hi, it's Helen and Karen here from Nurturing Nurses. Today we've just come on to go through a demonstration with you of how you would take your baby's temperature. Now, a normal temperature for a baby would be 36.5 to 37.5 degrees, and anything over 38 degrees we would classify as a fever. Now, you might be thinking, well, when would I be taking my baby's temperature and for what particular reasons might I be doing that? So if your baby is showing signs that they're just a little bit grizzly, might not be wanting to feed like they normally do, they might actually feel hot to the touch when you're changing them or holding them. Times like teething and things, they would normally get a little bit of a temperature, or those little newborn fevers, coughs and colds and things like that. So you might want to have a temperature device at home, a thermometer that you can use to check that.
Now, there are lots of different devices on the market, but with an infant, and when I say infant, I'm talking about babies from 0 to 12 months of age, the best way of checking the temperature is under the arm. You can get devices that read infrared temperatures, maybe across the forehead, and you can buy devices that you pop a little probe into the ear. We call that tympanic temperature. But the best way from 0 to 12 months of age is under the arm, which is what we call the axilla temperature. Now, the thermometers that monitor an axilla temperature look a little bit like this. So you switch them on and there's a digital reading at the front of the thermometer there. You can buy these from your local pharmacy and they're really inexpensive as well in comparison to some of the other devices on the market. So to use this, oops, we just take it out of the cover and then there's a little on button just on the front there. You would switch that on. I think it is already on at the moment. You would want to remove any clothing. You can use any arm, doesn't really matter. And you would place the tip of this thermometer right under the baby's arm. If I can get a little bit closer and just show you, right under the baby's arm, and then you would hold your baby's arm down. And you would leave the thermometer in place there until it beeps. And once it beeps, you can remove the thermometer from under the arm, and then the temperature will be displayed on that digital display across the front of the thermometer there. That will give you a pretty correct reading. Okay. We never stick these thermometers in a baby's mouth. We really don't do oral temperatures on babies and young children anymore. It's a choking hazard, and once they have teeth, they could actually bite down on that and dislodge any fittings at the tip there.